Smoking compromises the health of millions of people. One cigarette contains over 4,000 carcinogens. Smoking is a global epidemic, contributing to 4 million deaths. If the current smoking trend continues, 1 in every 6 adults will be killed by 2030. Smoking is a leading cause of premature death, elevating the risks for a host of chronic morbidities. According to Centers for Disease Control and Prevention, smoking increases the risk of lung cancer by 25 times, stroke by 4 times, coronary heart disease by 4 times. Rising smoking rate also hinders economic development and overwhelms the healthcare systems in underdeveloped nations, with $2 trillion being lost as a result of decreased productivity and increased healthcare spending.
According to the CDC, the Center for Disease Control in the United States, people with lower levels of education and lower socioeconomic status tend to have higher rates of cigarette smoking. People with lower incomes tend to suffer more from diseases that result from cigarette smoking, and they also tend to smoke more heavily. Because populations who have lower incomes have less access to healthcare, it's likely that when they have diseases that they're diagnosed at later stages. Some research even suggests that tobacco companies and big retailers often have higher density of advertising in low-income neighborhoods. On a global level, China and Eastern and Southern Europe consume the most cigarettes per person. In places like Southeast Asia, the Eastern Mediterranean, and Sub-Saharan Africa, smoking among youth is very common. Young people use products like pipes, hookahs, and smokeless tobacco in many social situations. Youth may have several reasons for starting tobacco use before they're even the age of 20. These reasons include looking cool or mature. Other reasons could be that they are exposed to smoking by their parents or advertisements, or that it's seen as acceptable behavior among their friends or peers, or to cope with anxiety or depression. Regardless, what we can conclude from this is that vulnerable populations like youth or low-income populations are most susceptible to tobacco use and are most susceptible to marketing by tobacco companies.
Smoking is really bad for your health, so it's from the highest importance that we protect the present and future generation about the consequences from smoke exposure and tobacco consumption. This is also why the WHO started in 2005 with the WHO Framework Convention on Tobacco Control, so governments can use this framework to implement tobacco control interventions. The WHO framework consists of Empower, that has 6 components. In 2017, 43% of the world has implemented 2 or more measures of the Empower of the WHO. First of all, Empower consists of monitoring tobacco use and prevention policies. There are some countries with monitor initiative for tobacco usage. One of the good examples is Nepal. They have the largest health warnings on the packages of cigarettes there after they detected the high prevalence of smokers with a survey. The Peace for Protect People from Tobacco Smoke with smoke-free laws. This is implemented in 55 countries in the world and also visible in Taiwan at the National Taiwan University. Offer to help quit tobacco use with treatment for people with a tobacco addiction. The cigarettes packages in Taiwan offer a phone number people with an addiction can call for help. The W is from warn about the dangers of tobacco. There are a lot of countries that have had an anti-tobacco mass media campaigns in the last 2 years, and there are also a lot of warnings on the packages, as you can see in Nepal, but also in the packages of Taiwan. Further, there's enforced bans of advertising, promoting, and sponsorship. This is a hard subject because it's in conflict with the tobacco industry and its possibility to sell their product. Only 15% of the world is covered by a ban of advertising, promotion, and sponsorship. And last but not least, there's race on taxes. The of the taxes is proven to be the most effective and the best way to reduce tobacco use. Despite this knowledge about the effects of raising the taxes, this intervention is still not widely implemented. Only 10% of the world population is covered by this. Our advice is to use taxation more because it's proven to be the most effective, and it's effective in two ways. First of all, it will reduce the purchase of tobacco, especially by younger people, and it will raise money for the governments that could be invested in public health programs.
Due to loose law enforcement on the restriction of indoor smoking, the Japanese government made an extra push this year for tighter regulations. At the front line of this movement is Health and Global Policy Institute, a non-profit and non-partisan think tank established in 2004. HEPI has been working with the government since 2009 on tobacco control, and here is what the president has to say.
What are important aspects or roles of HEPI in tackling tobacco control in Japan?
Well, I think we have two roles in tobacco control. One is gathering the stakeholders. The tobacco control should consist of stakeholder commitments, not only politicians but also academia, patient organizations, and also industry, also like pharmaceutical companies, but also tobacco industry itself. Those stakeholders needs to come together, and we as independent think tank, we're very happy to provide like sort of neutral, secured platform that everybody can discuss what's the best scenario for the next as a next step. The second point that HEPI can do and has done is data collection. Tobacco control is quite scientific, and scientific approach is critical to push this evidence-based policy forward. And both channels are really critical, and that's something we can do.
Okay. And what are some foreseeable challenges for HEPI in dealing with tobacco control in the future, and what do you think can be done to solve those challenges?
Well, that's a very good question, actually, and tough question to answer, because politics is, after all, politics. That's even we showed evidence-based data, multi-stakeholder discussions. After all, politicians in general are quite influenced, have been quite influenced by tobacco industry a lot. So, and not only tobacco industry actually, but also like restaurant associations, hotel associations. And another challenge, or there's something we can do to change this frame, is firstly that we can bring more voters outside of this inner circle. If like normal consumers, patients, they raise voice and they vote for in the democratic process that for anti-tobacco, the politicians will care about us more. And second thing is to persuade this internal circle, internal status quo to be changed, to be more pro-tobacco control. We are very eager to participate in this movement.
Progresses have been made, especially in countries where the FCTC was ratified, and wide-ranging interventions have been implemented over the past several decades, including taxations, ban on advertising, and plain packaging. Despite the tremendous anti-smoking efforts, the global burden of smoking has become ever greater due to the rise of smoking in middle and low-income countries. Therefore, a multifaceted and a collaborative approach to addressing this global health concern is in dire need, especially in emerging economies like China, Russia, and India.